So Kev, one of the most important questions of the day. What are the charges? If I wanted to go for a mental checkup, one, or for therapy, like what's the range? Because most people find or think that is very costly, very expensive, and it's only for the upper class.
Most before we end kwa charges, ningetaka Kev atu clarify between a therapist, psychiatrist, ulijita profession yako ni psychologist.
Yes.
Because that I'm a pastor ni counselor. You go through marriage counseling, like hata mimi pia naweza jita therapist kwa mwasa. Because nimekuwa nikimwambia bana, go put your house in order. Naweza sema because nilimpea advice. Mimi ni therapist. Again, to clarify here that your profession ni therapist amani counseling amani.
That's a good question. So a psychiatrist is a doctor who and mainly they deal with the medication part. So and a psychiatrist unaenda kumwona, they review you, then they prescribe medication that you need. Now a psychologist works with a psychiatrist. You work with a psychiatrist where now you take them through the we call it like talk therapy, and you use different approaches for different mental illnesses or conditions. Like there's one called cognitive behavioral therapy, which you just teach the person how to challenge negative thoughts, like is this a fact or is it an assumption? You know, so a psychologist will spend more time with you. They'll see you for, between 45 minutes kwenda juu, mainly basically inakuwa 45 minutes to an hour. Psychiatrists, maybe you'd only see them for like 10 minutes, 15 minutes, but you work together so that it's with a psychologist works together with a psychiatrist so that it's comprehensive. Now a counselor doesn't have to only deal with, they don't only have to deal with mental illness. It could be just life events, life issues, but you can have a counseling psychologist also. So it's
they're almost the same.
So all of them can be categorized as therapists. The umbrella word can be therapists.
So different sides
for exactly. But now, psychiatrists, they deal with the medication. Psychologists, you do the therapy. You work on techniques with them, coping mechanisms, unpacking. And you work together with the psychiatrist. A counselor can have, like as you said, marriage counseling or
HIV and AIDS counseling.
They can do different walks of, different.
As a psychologist, do you specify in, like, do you specialize in let's say marriage or like relationships or certain disorders or mental health?
No, like me, I'm a clinical psychologist. So clinical psychologists, we deal with mental illness a lot of the time. I don't work with couples. I think those they benefit from a couples specialist, a marriage psychologist, things like that. You'll find kuna wale they specialize in trauma, they specialize in marriage, they specialize in children, pediatric. So
as a psychologist, you can specialize.
You can specialize. You can specialize.
I was watching someone who was saying that you said they're called psychiatrists, those who prescribe. That we should be very careful of those professionals, because some of them, just like some doctors, they're very unscrupulous and they work with pharma just to pump out the drugs, even if you don't really need them. Again, I'm not attacking that profession. I'm just saying that I prefer mostly a psychologist who you talk to, because sometimes you just talk and you tell me do this, do that, and I go do that and it works. But for this other group, whereas the drugs help, it's a chemical imbalance. Some of them will just prescribe just to raise their earning or whatever, even when it's not overly necessary. Because this person was talking about ADHD in kids, and was talking about how these children, some of them ADHDs, attention deprivation,
attention deficit hyperactivity disorder.
Exactly. So for children, when you're growing up, you're overreactive because you do those things. And then they say, this person is suffering from this disease because whatever, you can see how he's acting. But it's just a child being a child.
Right.
And then there's nothing there. But again, if you're going through something, seek help.
But Moss, this I don't think you need to apologize to anybody. In the Western world, like in the USA, this has been a challenge to many people. Like people are being given just drugs. You go present yourself that I have a mental health problem. You're just given pills. Everybody, like, they're just prescribing people with stuff. But I'm sure it will get to us at some point. The question is, how do you think we should deal with, because it's a problem in America, it's happening now, like people are getting addicted from drugs prescribed from just showing up and saying you have mental health. How do we prevent that from happening to us? Not to
and we make sure that these unscrupulous people are dealt with properly, so that it's not just pumping out drugs for your bottom line.
Well, okay, so like the you see, one thing about, like, in the US and even in the UK that's different from here. You work together with a psychologist. So someone, let's say for example, someone comes to see me, we'll do the therapy. And I usually tell them, if I notice that your prognosis is poor, like you're not getting better, you're continuing to deteriorate, we can have the option of medication. Now, the thing that the psychiatrists, especially that I work with a lot, we practice this thing called quality rights. Now, with quality rights is you let the patient know about their rights. You give them the option. You ask them, okay, would you like medication or not? And they're the ones who are to choose that. They're the ones who the ball is in their court, really. They have the right of choice, and you just make them aware of the options, what the medication does, and things like that. So I mean, like any other profession, you may find that there are those who abuse, who just prescribe like that. To be honest, the best thing is if it's preventing it, if you is your own awareness. Like, as an individual, just learn about mental health, learn about the different things. Like,
you're talking, because these things will come to you eventually. Because you'll have these big companies dangling money on your.
I mean, pharmaceuticals.
They'll do that. And my next question is, what made you choose psychology? Like, what made you feel like I need to do psychology? Or is it something you're passionate about? Or when did you learn about it?
Or is it in supermarket?
For me, it's because you're getting money from it. Because for me, this thing is like fairly new to me. We never talked about.
Well, so I in high school I did this thing called IB. It's International Baccalaureate.
What's that?
It's like
secondary school.
I know he doesn't. Explain for him.
International Baccalaureate is like it's like from 5 and 6. It's a British system thing. After you finish O level, to enter A level. So A level, you can choose between doing A level or you do IB. Now IB is quite intense. You do like 3 subjects at a higher level, 3 at the standard.
Unaweza quite intense. Sisi time tukisema 844. Wasi walikuwa wanaenda kwa option different. Walikuwa waga this mbaya. Ukisema quite intense, hizi na feel like quite intense.
IB. Kuna wase walitoka form 4 wakakamfanya IB au kumaliza. It's not it's not a walk in the park.
So toka from 4 tukaenda kampuni.
Na mtu aingiangi tu hivyo, unapetiwa. You have to be
IB.
So anyway, one of the
IB ni nini?
international baccalaureate, and then you finish with a diploma. It's think of it like A level, but you do 6 subjects instead of 3.
How much time do you spend?
2 years. And then you also
so
you
after
have
that, then you join.
Yeah. So now one of the subjects that was offered in that program was psychology. So I mean I just
So that's what you did.
Yeah, I just did that. In fact, niliambiwa you can choose between economics and psychology. Then I just went to nilikuwa nafanya higher math but so staki kufanya math ingine. So went and did that, and I just found it fascinating, like understanding human behavior, why people do the things they do, why people don't do the things, certain things. And from there went to university, did my undergrad, did my masters.
So what was your undergrad in
psychology, and then
psychology.
My masters was in clinical. No, in Scotland.
Do you have courses or universities offering psychology? I'm aware if we have when do they start?
The University of Nairobi.
Kevin, I wanted to Kisha didn't cut off like 30 minutes ago. I wanted to know, because some people right now, one of the prohibitive factors this mental health services that they so richly require need the charges. Most people think it's very prohibitive, that the cost is very high kama hizo. In your professional opinion, without going into maybe still not to be but like what's the range of like a proper session, if I was to go for a session, the range from how much generally for like what that hour?
Okay, so you in private practice you may find like the range is from 2,000 going to 5,000 there. There are those who also charge even more depending on their credentials and their specialties and seniority and things like that. In Mathare I know it's 500 shillings
per session.
Yeah, a session.
Okay.
Yeah.
But before kimbie, does it matter? Let's say for example I go there with bipolar, maybe Kisha schizophrenia and whatever. Do they charge you depending on the issue you're going through, or it's just blanket? You just want consultation.
It's depending on the issue, because a full assessment is done, so there'll be a full assessment.
And how much is that?
Diagnosis? It's the same. It's the same, man. You can even find seeing a psychiatrist in public hospitals. There's even one called Royal Victory Hospital, where it's a private hospital, and for sessions they're charging 1,000. So it depends on the area. One.
but Kev, when you say it depends on the area, me, I'll just go there. I don't know what's happening to me. I just have a problem. Me, I'll just approach as if like this is mental health. It will depend on like is it depression, is it all these things that you've mentioned. But me, I won't know that I won't go and tell the doctor or I'm suffering from depression. I'll just go and present my problem.
Oh yes.
So for that, will I be charged the 500 or will I be charged more?
Yeah, you'll be charged the 500. Yeah.
Okay.
So because the clinician's job is to determine what the problem is. You're just going to talk about this is what I'm going through. I'm not sleeping well. Then they'll be able to give a diagnosis of what that could be. And and so there are places where it's more affordable than others. Insurances are covering mental health also now. So I mean, it's an investment. You can buy, if let's say there are things we can easily or more, not easily, but like we'd be willing to spend that 500 bob on. That is alcohol. I mean,
It's not too expensive. If it's 500,
if
you can
like
spare
that, you can spare that 500 for that alcohol and see. Okay, let me go for therapy and see what happens. Especially if you're going through something, you know. So
and it's once a week, isn't it?
and it's once a week, Of course, not to say everyone can afford it like that, but I just think if it's looked at as an expense, then you know it's going to limit you, but it's an investment and it can go as have longevity.
As a professional, don't go into detail. Just tell us, what do we expect when we come for a therapy session? Do we expect, because people like wase wana consume stories different, wase wana consume that buda nikienda hapo umse ata read back my problems to me and be buda una get like what should we expect, because kila msi akona vitu mingi amesoma place ama get like
kuna maquacks
kuna maquacks, because mimi pia buda nimekuwa nikiambia mwas and the gym bana ni therapist but stay hard, no days off, no days off bana, me therapist like as a professional. What should we expect from therapy session?
So in the first session, a full history is taken. So a full history is like you look at the presenting issues, like okay, why are you here, right? I'm going through this, I can't sleep, my mood is this way, Then you look at the past medical history just to see, is there anything from your past medical history that could be causing what is happening now. Then you look at personal history. Now in personal history, before you even look at personal history, after past medical history, are you taking any medications currently? Just to see, could that also be an issue? Then you look at personal history. Now personal history, you go back from childhood, from when you were born and raised up to now. All the endeavors of your life, school, work, if you moved, if you've married, relationship, etc. Just to see the pattern there. Then after that, you look at family history, like your parents, your siblings, muli grow up aje, you know, are they okay right now? Is there a history of family? Is there a family history of mental illness? Then you look at social history, just how your social capital has been, friendships, etc. Substance history. Are you taking any substances? For how long? Which different ones? If you stopped, why? Forensic history. Anything, any litigations you're experiencing, or any just things to do with the law that be contributing. Then you do a mental status exam. Now, a mental status exam, you look at like things like appearance, behavior, mood. Is the mood congruent to the face? When you're telling me, hey, I'm happy, is your face because it's not congruent. You look at the speech, the tone of the speech. Is there eye contact? The posture. Is there any perceptual disturbances? Is there any delusions? How is their judgment? How is their concentration? How is their insight? And then now from that okay, what I like to do personally is if let's say if you're married, for example, I would recommend that can I have a session with your partner or your wife, right? To just know what has she observed also. Also has she observed other things as well, so that it's very comprehensive. Now from there, I'll be able to know, okay, what we're dealing with. It also involves assessment tools. So you can be given tools of assessment, assessment tool for depression, for anxiety, just to rule out. And then from there, now you make a comprehensive diagnosis. If you see a psychiatrist also, they will do the same thing. And then we put our notes together. If you're an inpatient, a psychiatric nurse will do the same thing. So 3 people have taken your history. So it's comprehensive.
From what you've described, in my field, we'll call that a situational analysis. But what will you expect as how help, like if you've determined everything, like you've determined that he's like you've gone through this all the analysis you've had, like what, like not going to specifics, what will be like the solution to like what will I expect, like as a output to what I'll come out with, like I've gone to this session and I need like what will be the result, like will you tell me how to deal with my issue, or depending on what I'm dealing with, or will you give me medicine, or will you tell me how to let's say I'm going through depression, will you tell me how to become not or what should I expect from you?
So there'll be a therapeutic plan, and then most therapists will recommend 8 sessions. So 8 sessions, maybe 4 weekly.
Each at 5,000. Those are really okay.
First 4 weekly, the other 4 every 2 weeks. But also, you know, you can be asked, like, what do you feel you'd like to like I'll tell you, this is a therapeutic plan, but what do you feel you'd like to benefit from therapy? So unaweza niambia, I want to deal with my anger also, you know. If I feel like the symptoms are severe, I will give the options. I will say, you know, there's also medication, and this is what medication does, etc. Now it's for you to choose at the end of the day, because you have the right of choice. You know, the best we can do is give the recommendation. But it's you to decide. So you'll hear someone saying, okay, let me start with 2 sessions of just the therapy. If things are thick still, then, you know, I will see the psychiatrist you've recommended. Or some will be like, next week is a battle at work or something. Let me just have medication because I haven't slept for 3 weeks. I just need to sleep, and you know, and then I as we do the therapy. So it varies depending on the person.
Sorry, Moss.
Okay.
If I may ask, from the people you've helped, what do you think the feedback has been? What has this feedback been like? Are they feeling that they're in a better place, or do they still feel that they need answers that maybe you are not able to provide? From experience, what's the feedback you've been
maybe
getting?
Before you answer that, just to add on his question, and I know professional code of conduct and all that, without mentioning names, has someone ever come to you with a problem and you've listened to them and you're like, this is a lost cause, there's nothing that can be done for this person? Maybe
honestly, not yet. Not yet, because there's you know, there's I believe there's always something. If I don't feel like I have all the answers, I recommend to someone else. I'll be like, I'd refer you to my colleague, you know, just to, because I believe in second opinions, even third or fourth opinions, you know? So there's that. I've gotten a lot of my feedback is positive, to be honest. I'm not saying this to brag.
You can brag. If you're good, you're good.
You know, and it's positive in a way of it's not that all their problems have been solved. Right? It's just that they're aware of the problem, they're aware of their abilities, and they're able to maneuver these problems better, or they have more insight. You know, like there's a type of growth that has happened despite, you know, which way it's gone. And even a lot of them, they tell me, hey, you know, the things you tell me, I go to my friends and I tell them the same thing, and you know,
they get
help.
Yeah.
So I would say there's that growth happens. There's a self-awareness and growth that happens, and insights that happen with therapy. So I believe, like, you know, give it a try, see how it goes, you know.
Okay, I have. Okay, let me just ask the first question then. Once you answer, I'll go to the next one. So you had when you're starting this conversation, you said someone who his mood is just down, he wants to be alone and all that, could be a sign of mental health issues. So what if this person that's his character. It's just a
like
loner,
an introvert.
and then all of a sudden he becomes an extrovert. Just all of a sudden he wants to go out, he wants to drink, he wants to be in crowds. Could that be a sign of mental health issue that he's gone from one extreme to another?
Yeah. I mean, if you see, if it's unusual, you know, if the person, you know, maybe doesn't naturally, they don't go out as much, do, you know, talk as much and things like that, then you notice all of a sudden they're going out a lot, story mingi all the time, they're hyperactive.
Nikawa msikunyongi sana, but all of a sudden
The election
you know, they're hyperactive, they're you know, impulsive and things like that, and maybe that's not, you know, what they've been for a while. It could be an indication that they're going through, you know, a mental health condition. And not to say, you see, having a mental health condition doesn't have to be extreme, you know.
It doesn't have to be illness.
Like mental health condition is mental illness. It's the same as mental illness. Mental health now is different. Mental health condition is, you know,
Gotcha.
Yeah, I think mental illness triggers people. When people
So there's health and illness. Condition.
So there's mental health and mental illness. Mental illness can also be called mental health condition.
Okay.
Because it's a health condition.
So you go enjoy see. So I wanted to ask you, Kevin, also in your day-to-day work. And this will sound like a useless question, but which generation do you deal with the most? Is it like millennials? Is it Gen Z? Is it boomers? Yeah. Which group do you find are more open to therapy, and which group are more open to coming to that afflicted by that medicine?
So I have people from different walks of life and different ages. From ranging from 70 to 12. Yeah. 12 years.
12 years.
The 12-year-olds who are depressed, I'm telling you, like even like in schools now,
I can guess they're coming from
affluent families.
No, not only that. I mean, the bullying is on another level nowadays.
Some bullying is
worse.
No. Now it's social media.
Okay.
People are making memes.
Okay.
Imagine,
you're bullied by the whole world.
Unakuwa viral.
That makes sense.
So, but like majority are millennials and the a lot of Gen Zs, Gen Zs, they're being very deliberate with their mental health.
Is the problem with the internet amani because umeleta internet kama one of the causes. Yeah. So can you attribute more Gen Zs coming to you to internet?
Not necessarily. Of course, it's a contributing factor because you know, like pressure, comparison, things like that. But also, you know, for some of them, it stems from also their childhood. Like there's some that have had some traumas, losses. You know, like having friends that have died by suicide.
So they've not committed suicide. I'm just learning that word.
They died by suicide.
Committed suicide. Died by suicide. It's how we phrase the man and check about it. Akili yangu I just can't use those phrases. I'm not laughing at suicide.
Okay. So so it's different things. But of course, social media, internet contributes. Like, I mean, especially with Instagram, there are many people who have body dysmorphia, where they're having body image issues a lot. And then if they were in their childhood, they were being called fat or nini or hey, you don't look nice. And then now in their adulthood, all this is in their faces. You know, it's come something that has graduated. So
I was reading somewhere and they're saying exactly what you're saying. Some of the causes of mental health issues is social media, living alone, and let me read that is survival not being a priority. And I'll explain that. So living alone, obviously, kisha amesema akiwa peke yake, mental health, anakuwa na mashida. When you are here is talking.
Mimi sikuwa peke yangu, mimi Buddha, mimi ule governor wa Kiambu alisemanga Buddha.
A lot of problems
with mashida mingi. Nimejiletea mwenyewe.
So one of them is when you live alone, you have no one to talk to, you have no one to bounce your ideas with. So ni wewe na shida zako, so they just keep reverberating. So it's that social media, and then survival not being a priority is nowadays you have piped water, you have electricity, you have internet, you have everything. So now you graduate from that to now going to wants, not needs. And then the next thing I'm going to say is purely anecdotal. Hakuna any other evidence. I tend to think that most Maasais and Samburus don't suffer these mental health issues because for them they wake up in the morning they think of how am I going to make sure that we have pasture for our cattle, water for our cattle, fight the rustlers. But for us, because we have everything, we now start thinking about, oh my God, Kish has a 100-inch TV. I have a 50-inch TV. I need a bigger one. Because you have everything you need. It's not about survival now. It's about comfort. That imekuja kaanza kuleta mambo ya mental health issues. So the comparison thing. So I found that to be very, very interesting.
Me I feel the same thing. Nimetaka kuambia hii example that if we were never, like, as Africans, we were never open to seeing pornography.
Okay.
We wouldn't be open to going down on someone as a sexual pleasure.
Okay.
You see, but it's something that we saw.
We became conditioned to it.
We became conditioned because we saw it from somewhere. Like, it's something we learned from
what
somewhere. Like we learned because we've watched clips, we've watched stuff. Come on, Africa, Buddha. Na feel like tungekuwa like
hatukuwa hapo
missionary. But now because the internet ime open up view yetu kwa different options, different nini. Even chicks now feel that they need to have orgasms. Unaget.
Okay.
Walikuwa tu poor without orgasms.
It's true because
Walikuwa tu poor. Walikuwa poor without orgasms. There are so many chicks walikuwa poor without orgasms. But now that the internet may open up the world to these things, like you can do all this stuff. Sisi, I think imekuwa brought na pornography.
Porno
like there's these things, these styles, this the chick needs to feel this way, or imefanya like our chicks, like African chicks, what feel like
expectations
imekuwa. Sisi kama boy pia to feel like Buddha, you need to
the only you can have a good sexual
you get. It's the same thing that tuko na options mingi, so tuna feel that
wait, is that a mental health condition? Because now I've been forced to because back in the day, like you say, all you needed to do was just do the act and it's good, but now you have to make sure that she gets off.
For us, sex was for procreation. Like they didn't matter, like squeeze other chicks wanasema like they need pleasure, which was never a thing. Sex was for procreation,
and it has led to a lot of guys dying because of popping the pill trying to make sure that they get there.
It's what kupoteza baby. Because it's part of mental health. What do you think about? Like, do you feel that we are open to more opportunities and more options? That una feel we are overwhelmed with vitu za kufanya, like una feel like ile kitu kuna do saizi it makes sense. Kama kitambo ulikuwa na make to do yako na ulikuwa na make do yako na kufanya tu jobs but saizi Buddha lazima do go a certain way ndo ufeel
I see the thing about life is growth. I don't think we stay the same.
I saw you going there from mine.
Growth and progression. We can't stay. Wanasemanga change is the only constant. You know, of course, even like for the example of sex, you'll find maybe 50, 100 years down the line, it's going to be even crazy, more different and more
crazy
exploration approaches.
More
and more. Even mental health, you'll find that. Who knows? Maybe 50 years, 100 years from now, the things we're doing now, some will progress, some will be
go back.
Disproven or something, you know what I mean? They'll be wondering, hey, these guys were doing this like in 2020 years. So I think, the internet.
So Kevin, during the break I was talking to you about something. It's called DNS5 or DSM5. I have a problem with that, and I was telling.
What's
DSM5? Please. It's the Diagnostic and Statistical Manual. It's used to diagnose and treat mental illness.
Yes. Okay. So a few years ago, they had listed pedophilia as a mental health thing, and then there was a lot of uproar. People were like, "Hey, this is deviancy. It's not whatever it is that you're saying." And then they're like, it was a misprint. We apologize. We'll take it out. But if you've been watching the news, especially from the Western media,
who lists these things? Is this still the Western media, or is it like a body?
It's a handbook for
yes. It's different mental health professionals from different parts of the world.
It's what they are the ones who,
the top tier guys.
The top tier guys in every continent. They all come together.
But pedophilia, obviously, it was
top tier guys list pedophilia.
It was listed in that DSM
by DSM
professionals. DSM, but those professionals. So those guys listed it. There was uproar, and then they removed it. The reason as to I'm bringing it up right now, I consume a lot of American news, and they have reintroduced it, but under a different name. They're calling it MAP, that is minor attracted persons, and they're listing it as an orientation. Now that's why I have a problem with the whole mental health thing, because it will be listed as it's a preference thing, it's a mental, they're going through things, they can't help it, when clearly you and not you, but we can clearly see that this is deviancy. But when you classify it in that umbrella of mental health, if I try and point a finger to it and say this is deviancy, I'm listed as a form, some type of form or an ism. You're
not woke.
I'm not woke. Either phobia or something easy. So this thing is also weaponizing this whole mental health thing to try and curtail conversations about certain things.
I think like by the time they put it like in the DSM and they put it like the criteria there's a lot of it's not like they just look at the person and they say, okay, we're going to say this is what they have. There's a lot of like research they do, brain scans they look at, things like that. Of course, it's triggering, and it's not to say that someone with MAP is not going to face the consequences. Not going to face the consequences of those actions. It's not to be used as a crutch. So it's the same way like with a psychopath, right? A psychopath, yes, their brains work differently. And if it's a psychopath that's like a serial killer, at the end of the day, you've killed people. Yes. So you just have to deal with that consequence, despite what it was. So saying weaponize is hard.
Let them go to jail.
Yeah.
Right now,
Exactly.
I saw one who was actually even doing a Q&A.
Yeah.
And he was talking about how children have the ability to consent and give consent to.
Really?
Yes.
Oh,
I wish I could link it to this.
I've not seen this.
I'll give you, I think, the link. This guy is very open. He talks about how he has a 13-year-old girlfriend.
Huh?
It's very disturbing, and he's very confident and he's answering those questions. So for me, I'm like, if they say it's a mental health thing, because now if you say that, like, I can't help it, so you can't use that against me because I can't help it. But clearly, it is deviancy, and I'm like, don't say it's mental health. Why can't you just say there's mental health issues? Yes, there's this and this, but then there's also deviancy, which you have a problem when you're like psychopaths. You can't help it, but you did wrong, so you will not condone that. If we're going to agree on that, I'll be behind that thing 100%. But if you're going to use that to rubber stamp bad manners,
I agree. It's not, it's not to be.
I'm going
rubber stamp.
As a professional, people come up with this stuff for you, like tunakujia na mashida zetu zote.
Shida tungunzi.
Bana, tunakuja na magunia, tunakuja kwa tuna place hizi shida zote. Like as a psychologist, where do you get your
how do you deal with all that?
How do you deal with all
because you become a dustbin. You know their problems, they just dump
because we're all humans.
True.
Tunakam hizi na shida zetu zote, tuna expect buda wewe ndo you have all the answers. Unisaidie. Wewe nani anakusaidia wewe?
So I also have a therapist.
so you go to him, he goes to someone else.
So I have a therapist. We do, even with colleagues, we do debriefing. Like, you know, there are times we just go for lunch, we just have a chat, you know.
Story yangu mnasema
kuna pala fulani
kisha kuna story nyingine bana.
I'm dealing with an
different bana. Hebu sikie hii story.
So tuna debrief. I'm also quite physically active. I do Muay Thai, I do yoga.
You do?
I said yoga,
So like by that unasema hizi physical activities zinasaidia sana. Ambia bishti yangu. Unatembea kwa unasota una gari.
Zinasaidia sana. So I try to, you know, just with the physical activities, it helps. And I try to take care of myself, like just making sure I'm sleeping well. I mean, it's a hit or miss sometimes. Making sure I'm eating well and just switching off. Like, you know, when you, it's very important that when you're out of work, because work is not your end all be all, it's not what nini.
True.
You just nurture the endeavors of your life, because you're not only a psychologist.
You're a human being.
You're a human being.
So hizo vitu tumesema kwa msee kama mimi mwenye bado siko open kwa therapy, ni do hizo tunasema, because I feel that
no, come for therapy, you benefit. It's a safe space with no judgment. You know, come, you speak about anything. It doesn't have to be problems. It could be you want to be self-aware, you want to learn other coping mechanisms. It's just a safe space with no judgment where you can speak freely and unpack.
When I was reading this thing, it's either called comorbidity or commortality. I can't remember. But when I say, if you have a mental health issue, there's a very big likelihood that in your lifetime something else might also come up. So uko na bipolar and then something else comes up. So if you feel like you're going through something right now, deal with it now. Get past it, so that it doesn't grow with something else. Deal with two more than one. Mimi tamalizia hapo niseme mimi this session imekuwa ni very informative kwangu. Sijui kusukish
and nimelike when you meet this session.
This session imekuwa very helpful kwangu. So thank you very much, Kevin, for coming through. Hopefully we'll have another time. Kish, so
thank you, Kev, by the come to pay zima maze na tuna hope by the uko open kukuja tena kupe easy free therapy sessions. I think tuna need na audience wetu pia, I think wana deserve. And I'll still take you up for the fight.
Yeah. Okay.
Let's do it.
All right.
So, Ruben podcast. Just we talk as we can.
Talk as you want to.
Thank you.